In this video, I'm going to talk about when and how much you should be taking of L-Theanine. Hi, I'm Dr. LeGrand, and I'm going to explain when and how much L-Theanine you should be taking if you're considering taking L-Theanine. Now, if you're new to L-Theanine, you might be wondering, what are the benefits of L-Theanine? Well, L-Theanine mostly comes from green tea, but what's really powerful about L-Theanine, it can really help with anxiety, stress, but also helps manage a lot of different neurotransmitters that we do have in our brain, such as dopamine, serotonin, GABA, which all three of these have a lot to do with stabilizing our mood. Dopamine, as you know, has a lot to do with motivation. Serotonin is more of our happier mood. GABA has a lot to do with regulating a lot with our stress. So really, you could see how the benefits do come a lot from just taking L-Theanine alone. So I'm going to break down this into four things: is talk about what the research has shown as far as what dosages to take for L-Theanine, what the doctors do say as far as, like WebMD tell us and other doctors talk about as what dosage you should be taking for L-Theanine, and then what I recommend to my patients and clients when I give them L-Theanine, and then of course when you should be taking what is the most ideal time to take it. Now, before anything, you should always be checking with your doctor first before trying any types of dosages, because I don't know what your medical history is, so you definitely have to be careful there. So the first thing is looking at the research. Now, the research has been experimented on a lot of different dosages, but what I have seen most common is doing anywhere from like 100 milligrams right before a test to see if that would improve it, and they did see benefits from improving test level score put out, especially if you had test anxiety. Other things that I've seen is taking about 200 milligrams a day, but even up to taking 200 milligrams twice a day. Now, the problem with this is I've seen, a lot of the studies where it's been just 6 weeks of taking L-Theanine to 8 weeks, but never really long-term studies enough to really see the effects of the dosages. Now, a lot of other doctors do recommend, doing probably about 100 milligrams a day to, you could even safely do up to 500 milligrams twice a day. Now, what I recommend when it comes to L-Theanine dosage, this really depends on looking at testing first. I always recommend doing testing first to see if you even need L-Theanine in the first place. Now, what kind of testing am I talking about? I'm talking about checking for different neurotransmitters throughout the body, throughout the brain. So, this is going to be looking at specifically your serotonin levels, dopamine levels, looking at GABA, looking at norepinephrine and epinephrine, which L-Theanine can help improve those levels. Now, why that's important is, let's say all those levels are low. They're just plummeted, or they're all high. This is the beauty about L-Theanine, is because L-Theanine does help whether your levels are high or are they too low. So in a way, it is probably a very safe case whether your levels are high or too low on dopamine, serotonin, GABA, norepinephrine, and epinephrine. All those different levels, when they are out of balance, you can still use L-Theanine safely, but there's definitely still things you have to be careful about as far as the dosages. So when I see these levels all being plummeted or too high, I will recommend a higher dose. So I will recommend about 500 milligrams twice a day. But usually a good starting point with a lot of my patients, I'll start them out at 200 milligrams twice a day just to see how their body does in adapting to using L-Theanine. A good thing to keep in mind is I always just recommend just start with the most lowest dosage, so probably like 100 milligrams a day, then bump it up to 200, to 400 to 500, and just see how your body does and adapts to it. For me personally, I do take the highest dosage of 500 milligrams twice a day, and I do find it really does help relax me, it helps calm me, and also helps me to be focused throughout the day because my nervous system is more on a calm state and more focused. Now, you might be wondering, when is the best time to be taking L-Theanine? Good rule of thumb is to take it, yes, first thing in the morning and at night, but to do it in split dosages. A lot of people like to just take it all at once, but I think you could benefit more if you split it into 2 different dosages, so morning and night. But the other thing you have to ask yourself is L-Theanine can give you more of a calming effect. So if you are finding that you're a little bit more sensitive when you're taking it, that you feel a little bit more drowsy a bit, you probably shouldn't be taking it too much during the day, and maybe do more of your dosages at night. The other thing to also keep in mind, if you do have test anxiety, it's good to take right before a test. Or if you have more anxiety in the middle of the day, I would do a dose in the morning and then also in the middle of the day. So it really depends on your situation, but that's where understanding first, what does it do? Well, it helps really calm the nervous system down. It helps improve all these different neurotransmitters, so it helps our mood, so it could also help us be more happy too. So these are just things of situations. So if you're more stressed at night and just dealing with kids or whatnot, maybe you take that dosage more at night than just the morning and the midday. But you're probably asking, Dr. Legrand, what are these tests? What are these tests that I could be taking? Well, I'm glad you asked, because I have a free guide in the description below. It is my free focus guide that basically goes all over the labs that you should be running if you do have focus and attention issues, and you should be downloading that guide. It also goes over other supplements you can also implement, other foods to implement, other foods to avoid. It's all in the information, so download it in the description below. And until next time, this is Dr. Legrand signing out. Thanks. Bye.